Great, we are going to get started. Thank you for joining our Young Professionals Forum today. Today we'll hear from Emmanuel Ardiabah and Kayla Videtich and Dr. Douglas Huber as they discuss their career path and the importance of mentorship. There is French translation for today's forum. Click at the bottom of the screen for the French translation. When making the selection, you can choose to mute the original sound. Good morning, good afternoon, and good evening to everyone today. My name is Symons, and I will be your moderator today. I am the Senior Monitoring Evaluation Specialist at World Hope International. And I have worked in various different countries in Africa and Asia. And I love to create a culture of learning and learning to support decision-making in the various programs that I am involved in. If you are new to Christian Connections for International Health, we are an international network of approximately 115 Christian organizations and 15 affiliated partners, as well as a few hundred individual members, all working in over 90 countries. CCIH's mission is to promote health and wholeness from a Christian perspective and provides opportunity for capacity building, networking, fellowship, and advocacy. Before we begin, I'd like to make a few housekeeping comments. If you have any questions, please put it in the chat box or raise your hand during the open question and answer time. And this webinar is being recorded and will be posted on the CCIH YouTube channel and posted on the CCIH website at www.ccih.org. If you click on the events button and go to the webinar recordings, you will find the recording there. Today, we will have a roundtable discussion followed by about 15 minutes of open question and answer, and finish asking you all some questions. Before I introduce today's discussants, please submit your answers to the poll on what stage of your career you are in. Great, the results are in. So we have about 22% of people working 10 years or more, 22% working 5 to 10 years. We have some undergraduate students and some graduate students here as well. So welcome everyone. Thank you for being with us. Today I want to introduce you to three amazing professionals who have joined us today. Emmanuel Ardiabah is a young Ghanaian global health professional who started his career as a medical doctor in Ghana. And I just want to say a shout out as he just graduated with a master's in international health in the Netherlands this month. He has also finished a 4-month internship at CCIH where he worked on different projects. Currently, he is applying for another master's in environmental health in Australia due to a strong interest he developed during his internship. We also have Kayla. She has a wide breadth of professional experiences around the globe. After working as an ER nurse for 3 years, she moved overseas to volunteer with mercy ships in Madagascar and Benin. She obtained a Master's of Public Health degree in Global Health from Harvard University. Currently, Kayla is the Director of Monitoring Evaluation at Cure International and is responsible for developing and implementing a monitoring evaluation program across Cure's hospital network in Africa and the Philippines. And last but not least, we have Dr. Huber. He is a Senior Technical Advisor for Reproductive Health. He has worked more than 40 years in international health with a focus on reproductive health, research and innovative community health projects that change national practices. As a missionary for the Episcopal Church, he was the HIV/AIDS advisor to the Council of Anglican Provinces of Africa. He served with USAID and on WHO expert committees for standards and guidelines on family planning practices. Now we will go on to asking the three panelists questions. So we will start first with an open question for all three panelists. What has your career path looked like and how has it changed since the beginning? Dr. Huber, would you like to start?
Sure. Thank you very much. And it's great to be with you this morning here in Newton, Massachusetts, and afternoon and evening where many of you are. I started out in public health, and I think the most formative part of those experiences were working in the field. First as an epidemiologist with Centers for Disease Control, going and working up epidemics. But then on the global level, working at community practices and developing community health systems that would work and working with my medical colleagues to do that. I think that evolved into more for me being not only international and working in the field, but also in organizations back here in the US, where I was a technical advisor and then a medical director for a couple of different organizations. It takes you to a different realm of being on the other side of the equation. There's the field and the headquarters staff. So being back in headquarters and developing those relationships in a different way was important. And then being on management teams and things like that evolved considerably, and then on expert committees and things like that. And eventually on boards to oversee organizations. So it's been quite a journey, a steep learning curve all along. And I think the faith component for me has been particularly relevant in that, seeing that that's where the real action is, and the importance of culture and values in terms of shaping where communities are, in terms of how we respond to health initiatives. And we can see evidence of that all over today, whether it's reproductive health or COVID or other health practices. So a lot could be said, but I'll stop there.
Thank you so much, Dr. Huber. I love the connection of the faith and all of your experiences that you've had in the field and also here in the United States as well. Emmanuel, what has been your career path?
Hello, everyone. I'm Emmanuel. I'm joining from the Netherlands. I'm from Ghana originally. And in Ghana, I worked as a medical officer. So I started in general practice, and then I developed the interest in going into global health. So I applied for international health in the Netherlands, which I graduated last week. Practicing in Ghana, I realized that there were more to health than just dishing out prescriptions. And as later I came to know about the social determinants of health, I thought that the Ghanaians should know something more that will influence their health, instead of just getting sick and coming to the hospital for treatment. So that was some of the burning desire, the thoughts that influenced my decision to go into global health. When I got here, I did so many things, not knowing specifically which area because at some point before I came, I thought I wanted to go into policy, but even in which side, I wasn't so sure. So I was just into this program, hoping to find a place. And fortunately, after my modules, I applied for CCIH internship, which I gracefully got the chance to do. So through that, I saw that my path was actually getting clearer, and now I know that I want to do something with environmental health, public health altogether. And I found a university in Australia that has a merge program of MPH with environmental health and focus on climate change, impact of climate change on human health. So this is where I am, and obviously I'm the youngest among the panel, so I'm also still learning and open to ideas. Thank you.
Thank you, Emmanuel, so much. Kayla?
Hi, everyone. I hope that you can hear me okay. I'm currently calling in from Zimbabwe at one of Kira's hospitals, so I'm hoping the connection is good the whole time. So far, so good. To answer the question, I think that starting with a background in nursing has been really formative for me in ways that I never imagined it would be. I became a nurse because I knew that I wanted to work overseas. And nurses are everywhere around the world, even though there might be different titles for other healthcare professionals. Nurse is kind of a consistent term. So I knew that if I became a nurse, I could probably go anywhere. So there were things that I kind of learned from my years doing clinical nursing that suggested that I might not always stay there. I was really interested in the bigger picture about what was happening on the unit. And I really loved assessing patients and the problem solving. And that's all very transferable to really any field, but especially global health. So I think I knew pretty early on that I wasn't going to stay an ER nurse for a really long time. But there have been periods where I was stateside and then I went overseas and then I came back stateside. Now I'm working internationally again. So it's been very cyclical, which is not something I necessarily thought would be the case, but it's been really wonderful. I never even predicted that I would go to graduate school, but working with Mercy Ships changed that for me. I realized that I didn't want to just keep seeing patients one by one, but I wanted that bigger, more societal approach, which is perfect for public health. So I think to sum up, I would just say that my path has been marked by a lot of surprise, because if you had asked me when I graduated, I would have known that I wanted to work overseas, but I would never have known when, where, with what organization. And so it's like each step that happened kind of opened up and led to the next step, which has been really fun.
Thanks, Kayla. Yeah, I love how for all of you, there has been opportunity that has opened up and you guys grabbed it and went for it. And yeah, just growing in your field and that it's okay to change your career path, but just keep going with your passion. So thank you so much. And Kayla, I have another question for you. What advice do you have for someone searching for jobs in public health?
I received really great advice when I left Harvard that I will share with all of you. So I was in a global health cohort. So a lot of my peers, they had jobs in really big like global health hubs around the world. DC, New York, Boston is where we were, London, and lots of other places in other countries as well. So my mind immediately went to, try to get where all the public health people are. But one of my advisors told me, and this was based on his own experience, he recommended seeking out a job where no other public health professional was. So join a small organization where you're the public health person, or go into a region where there's not a lot of public health work happening. And the reason he said that is because he said that when he ended up doing that, he learned a really wide skill set for public health. So I kind of unintentionally took his advice. I still applied for jobs in all of the big hubs, but I didn't have any leads there. So I ended up moving back home to Michigan, and I worked there for 3 years as a grant project manager at a local university. And I was like, this is not like what I thought I was going to be doing. But the reason I took the job was, one, because of that advice. And I thought doing grant work and project management is going to give me a really good skill set. And I was working with nurses around rural Michigan. And so I thought, you know, even if it's not exactly like the type of rural or international work I want to be doing right now, there's a lot of similarities among rural communities around the world. So, for example, relationships are really important, and that's true in northern Michigan, and it's true in Zimbabwe. So I think just realizing that I could take a different route than what other people were doing, and that has really served me well, even though, you know, it might have been hard at times to think, I'm not doing exactly what I thought. It still gave me a really good skill set.
Thanks, Kayla, and I love that advice. Thanks for that. And Emmanuel, you talked a little bit about how your internship has motivated you to your interest in environment. Can you tell us more about what motivated you to find this internship, and how did you maximize your internship opportunity?
Thank you, Ty. Yeah, so after I had finished with my modules and my thesis, I knew that the next thing after graduation would be to search for a job. So I started looking around. Then I found CCIH. Then I realized that, yes, it was a Christian organization where I can actually get the experience at the same, get global health experience, and at the same time within the framework of my Christian faith. So the biggest motivation was the fact that I wanted to prepare myself for a job, for a professional job. So I knew I'll be applying, and having an internship as your experience will also give you a better chance of getting a job. So I applied to it, I got a response. Then I was booked for an interview, which was fantastic. I had 3 different interviews. And the first one, actually, I was introduced to a new project that CCIH was undertaking, and that was climate adaptation project. And when I was asked about it, I didn't have any idea about climate change. I didn't have any interest. I hadn't learned anything about it apart from reading the news and all that. So I didn't know how it was going to go, but it was just that I needed to agree that I could be part. So I said yes. And then from there, I consciously decided to take some short courses about climate change before I even start the internship. So I quickly took a course on Coursera about the impact of climate change and human health. And then through the course, I realized that it was very interesting for me. Yes. So when the internship started, I had some knowledge to begin with, and that made it quite easier. Also, I indicated in the internship that I wanted to work on different projects instead of one single project, because I don't know where my interest would fall into. So I wanted to have a feel of different projects. And so that also gave me a huge advantage. So I worked on climate adaptation projects. I worked on vaccine hesitancy. I helped with the adolescent and sexual reproductive health guide. So all these coming together. But at the end of it, I realized that I had to go deeper into climate. And during the interviews, one of the people that I met was Ray. And in fact, after a short conversation with him, he encouraged me and said, look, your interest in climate change is something that I also like, and I think you will do well. So he also gave me that encouragement, and I knew that it's a place that I want to go. And that's how, by the end of it, I decided, okay, I might want to get another master with something around climate, and then keep on searching. So that's where I am through the internship, and where the internship has brought me. Thank you.
Great, thank you so much, Emmanuel. I'm glad that this internship brought you professional learning experience that offers, practical work as well as to direct you in a different path as well, but continuing your passion. So thank you so much. And Emmanuel, you mentioned, as a young professional, you had somebody, an advisor. And so I think I want to ask Dr. Huber, what constitutes a good mentor-mentee relationship? What is important about, having a mentor as a young professional?
And I think there's lots of ways to do this. Carolyn and I have kind of a semi-formal relationship where we get together once a month and talk about some topic that she's interested in and thinks I might be useful to her. But as I was thinking about this question, and also the experience of Emmanuel and Kayla, it seems to me that some of my most important mentors have been those who I just gravitated to. Leaders in the field who I admired. Ray Martin for Emmanuel would be a good example as a person passionate about environment and really is a person to be trusted. So I think, as you think about who to get advice from and who you will learn the most from, gravitate towards those people wherever you are, whether it's your professor or sometimes co-workers, and also leaders in the organization who you admire and are being effective, and be by their side and tell them how important it is that you learn something from them. As one of the questions that we discussed before is, what's in it for the mentor? Well, we as would-be mentors want to make a difference in people's lives, and we have a responsibility as individuals and as people of faith to bring each other along, to strengthen each other, to stretch each other, challenge each other in a good way that is leading to growth. And I think those examples, for example, when I first began working with U.S. Agency for International Development, in my short tenure there, I was told by the director, just start doing things. And that sort of gave me permission, and I would give that advice to others. And so I think it's not a matter of singling out a formal relationship, but knowing people and spending time with them and encouraging them to spend time with you, which sometimes means trying to be more useful yourself to others.
Great, thank you so much. And I know that the relationship that you build with your mentor and mentee, it's a mutual relationship where you both grow, and so it's a wonderful relationship that you can create. So I hope that as young professionals, you are able to find someone to have this kind of relationship, to help give you advice and to just listen to what is happening in your career. Emmanuel, I have a question for you. How do you know what areas to explore and what to focus on?
Yeah, this can be complicated. It can be a very big question. because global health is very big, and there are several areas. So there are people who come for the program knowing what they are doing. They are already working and they just want to top up or something in that area. But for some of us who are working clinically, and now we wanted to shift to global health, yeah, you can come with something in mind that you wanted to do health policy or financing or something. But for me, I was just open to all of what I was doing. And then even at this point where I'm not thinking about environmental health, I didn't know before my internship at CCIH, I didn't know this is where, this is what would be my desire at this point. So you just open up to it, you learn all what you are offered, and then I think through it, you might get clues through your lectures, through what you're studying, the research you're doing. You might get clues, you might get attracted to something. And then you might also want to do an internship like I did. And through the internship, definitely you will be moved to maybe one of the projects that you are working on, just like me. And so for those who don't know, I think you just have to have an open mind through what you are doing, and then you are paying attention, what grabs your attention, which areas do you feel like there's the need, depending on where you want to live. If you want to go back to Africa, which areas in global health have the most needs. You can think about some of these things, and then it can guide you through it. Some people already have their passion. I want to go into maternal health, and that's it. So yeah, it depends on you and what you are exposed to. But yeah, keep an open mind. Thank you. Thank you,
Emmanuel. I think it is definitely like our experiences, exposure to like internships, and just seeing, you know, the need where you live, where you find areas where you want to explore and grow. So thank you so much for just sharing with us about your different career path as well and your learning. This next question is for Kayla and Dr. Huber. So as you have started, you know, your career path, what type of considerations should you think through when negotiating employment? So this could be, you know, negotiating your salary, your hours of work, how much time you're able to have off. Kayla, would you like to start?
Yeah, I'm really glad that we're talking about this because it's so relevant. And when I started working, I had no idea how to approach these conversations. In fact, when I was just starting to babysit as a preteen, I asked my mom how much I should charge per hour. And she said, tell them they can pay you whatever they think you're worth, which is not what I would suggest you tell a future employer. But it's just kind of funny advice that I heard way back when. I think one of the main things to remember when you are entering into conversations about negotiation and salary is that if you applied for the job, chances are you want it. And if you're being offered the job, they want you. So I think it's really important to remember that employers want their new employees to be happy with the package that you take, because if you're unhappy, you're going to leave, and that's not good for them. So I kind of used to approach it with this antagonistic kind of like, oh, it's me versus them, but actually it's just a conversation together to see what will work for both entities. So one of the things I think is most helpful is just to think creatively about where you are in life and what is most important to you. So if salary is most important to you, then know that, but also remember that there's people who do make a lot of money and they are miserable people and they make people around them miserable, but also we need to be paid. So I think it's important to know if you need to make a certain amount to survive, Or maybe you are thinking like, you know, I'd actually be a lot happier if I had a little bit more time off, but I was paid less. Because you can negotiate things beyond just salary. You can, I think retirement is a little bit difficult because it's kind of set in stone for a lot of organizations. But your FTE, the number of hours that you work each week, you can negotiate that. You can negotiate, you know, PTO and time off. Even now working remotely, like if you would be much happier knowing that you could work from home 2 days and then go into the office 3 days. I think just having the flexibility to think about what's really going to work for you to stay in this role, and then communicating that to the potential employer, that will help get to a better solution. And yeah, I think that like most people don't go into public health because they want to make money. Usually if they want to make a lot of money, they do go into a different field. But I think just thinking about like your life satisfaction and I've been in that situation before where I was in a really, really good spot financially and had really good benefits and everything, but I wasn't really happy. And it wasn't until I left that job and started a different job that I realized, oh, actually, I dreaded going into work every day because I didn't feel like I was using my skills in the best way, or I felt like I had outgrown that role. So I think just trying to think more creatively can produce some really fruitful and beneficial conversations, and just being transparent and try not to be nervous. It's always good to practice if you're really nervous about having that conversation.
Thanks so much, Kayla. Thank you for sharing your experience. Dr. Huber, do you have anything to add? If you can unmute your button there.
Thank you. Sorry about that.
Thank you. No problem.
Kayla touched on, a lot of good points, and sometimes it's a balance between, what's really going to make the difference for you, and realizing not just the amount of compensation, and the other benefits, health coverage, time off, and flexibility can be helpful. Sometimes, depending on the situation, help with transportation can be a part of the package. And then there's the key question of opportunity to advance within the organization, and realizing that every job you'll have will be a stepping stone to something else. Not assuming that you're going to be hopping from job to job. Staying with one and doing a great job and making yourself invaluable to the employer is key to whatever you do in the future, because that person will be making recommendations for you, and no doubt your future employer will be talking with that person. One piece of advice that a colleague of mine gave to, and this is gender specific, some women think typically, and I'm not stereotyping anyone, are shy about asking for an increase in their salary or in the initial compensation. And I saw how this worked to be not shy about that. And at the end of the negotiations, if they really want you, say, is there any opportunity? Could you make it a bit better? Either with a number or just that way. And sure enough, this particular individual from CCIH, who was moving on to another organization, she had a perfectly good job offer that she was thrilled with, and she asked, could you make it any better? And they bumped it up another 10%. So sometimes, especially for women, if you feel a little nervous or shy about that, take that advice. It worked for her.
Great. Thank you so much, Dr. Huber. Appreciate the advice there. Well, I want to thank all of our speakers for sharing their thoughts and experiences. We want to now open up to questions from the audience. Please put your questions in the chat box. You can unmute as well, or raise your hand. Does anyone have any questions? Yes, go ahead, Prince Obeng.
Thank you very much for sharing your experiences with us, and also for telling us your journey. The question I have is it okay to perhaps have a mentorship relationship with your supervisor, the one who is directly above you and sees to perhaps that you do your responsibilities because of some of the conflict or so that may arise? Is it something good to look into? Thank you.
Thanks for that question, Prince. Dr. Huber, would you like to answer the question?
Yes, I mean, as I was implying, sometimes mentoring is a more informal process. If your supervisor is someone who's being very effective and you are getting on well, you know, sort of saying, you know, thanks for spending the time with me asking questions is a great way to get either advice or to learn something where you're not so familiar. As Emmanuel, you know, kind of related his experience as an intern, and myself being thrown into the deep end in an area where I really didn't know what I was doing. But learning and getting guidance about that, and developing yourself. But looking to those who are around you, and certainly supervisors, if that works, is great. It doesn't have to be a supervisor. There's other colleagues and other people who you may say, they're doing great work and I don't know how they're doing it, but let me learn.
Great, thank you so much, Dr. Huber. Ruth, would you like to ask your question?
Yes, thanks. I think there's a wealth of knowledge and I'm really grateful for that. I like that Douglas mentioned about the issue of the dynamic of women in the workplace. And for me, my big question is, as public health professionals, how do you manage to balance your family life and your profession? Because most of our work is about traveling. I think for me, that's one of the things that really gets me. The traveling, the being away from home, being a young mom, all your kids are under 5, you need to be in the field, the distances are long. How do you, and it seems as if I'm in a technical position now where I'm an advisor, but the projects are so many and the region is so wide that sometimes you wonder how to balance all of it. Do you take a step back and take something less, or how do you negotiate that time?
Thank you so much for your question, Ruth. Kayla, would you like to start?
Sure. Thanks, Ruth. That's a really relevant question, one that I've been thinking about myself. I have been married for 1 year and I don't have any children, but it's something that I think about because I love working, and my role at Cure does take me internationally. I think probably the best place to start is making sure that you're working for an employer that values family and values your role as a mom or as a wife or as a husband, whatever partner, whatever your role is or where you need balance, just making sure that your values align with that organization. And I can say that at Cure, that's one of the reasons I felt like I could work for this organization. I've only joined 3 months ago, but I felt like it would be a good fit for this stage of my life because they have said explicitly that they're very pro-family and pro-kids. And so that's like the first place I would start. And then in terms of the travel, my husband's here with me right now. I don't know if that's like an option for everybody. I don't know if we'll do that every time, but it's really hard, and I don't exactly have an answer, like a fix-all answer for it. In my mind, I've kind of just thought to myself, like, I will cross that bridge, especially with kids. Like I'll cross that bridge when I come to it, and have that conversation with my supervisor or you know, employees, find out how other colleagues have made it work. So I don't exactly have like a plan for myself right now, but I think working for an organization that I know is going to value my role as hopefully a mother someday, and currently as a wife is really beneficial.
Thanks so much, Kayla. Yeah, definitely. This is something that I think we all struggle with is in our profession, to find that balance between work and life. But it is a good advice that you provided, so thank you. Yes, Dr. Huber.
Yeah, I think Kayla's spot on, but I think having a conversation with your employer and explaining your own situation, and also some of this becomes, I think, probably personal, you know, how you manage it within your family. Do you have a partner who's supportive, who can help chip in, and or relatives? But you know, those situations are more individual. But as an organization, I agree, having an organization that recognizes that that family is also important.
Great, thank you so much, Dr. Huber. Emmanuel, I have a question for you from the audience. What is your advice for finding forums to network and meet others who can offer potential job opportunities?
Well, I think if you are in school, you start with your lecturers or your colleagues, your friends. So you start at a grassroots, and also you look for public health forums, conferences that you can participate. And once you participate, then you can also make contacts and broaden your network. So someone advised me, one of my teachers advised me, he said, if you want to work for an organization like WHO and you don't have any contact there, then you look through, for example, I'm networked with some of my teachers, and then you go through their profile, and then you see that they have people who are working in WHO. Then you write to your teacher, hey, I've seen that you have a friend who works there, and I would also like to know how they made their way there. So you go through whoever is your first network person, and then you tell them that you would like to have a contact with their friend who is working in the organization that you intend to work in. So that is also another way that you can also broaden your network. But I think participating in forums, global health forums, and other things, and while you are there, you try to establish contact with some of the people you meet. That is a great way to do that.
Great, thank you so much, Emmanuel. At this time, we only have time for one more question. So Jenna had a question. Any thoughts on moving between domestic, USA, and international health over the course of your career? Is it typical to pick one route and stick with it? Dr. Douglas or Kayla?
Yeah, it certainly wasn't in my case, and it's I guess what feels comfortable with for you, having worked with non-government secular organizations much of my life that are in international health. I never thought I would become a missionary as such, working in Africa with the church, in this case, the Anglican Church, on HIV/AIDS at the height of the epidemic. But that seemed to be a calling at the time, and so I followed it. And it was, in retrospect, one of the more formative experiences of my life. And that, for me, at that stage in life, it was an unpaid volunteer mission position. Just my expenses were covered. So the course for some of us runs the gamut, and kind of following your heart as well as your head in those decisions, I think is sometimes useful. Sometimes there is a calling, and you need to listen to that as well.
Thank you. Kayla, do you have anything to add?
I certainly am not someone who's just going to go in like a straight line in my life. So I would say for me personally, moving back and forth has kind of been the story. And I think whenever I am back stateside, I try to make whatever work I'm doing still relevant. And like Dr. Huber mentioned, like a stepping stone. So if I also know lots of people who were working overseas, but there was a crisis or a family member was sick and they had to move home. And that's hard because sometimes we might find ourselves in places where we don't necessarily want to be for the time being, but if we can make it meaningful and see it in kind of the scope of a grander plan, then I think that's helpful. But yeah, for me personally, I think it's been a lot of moving back and forth and just being flexible with kind of whatever opportunity comes next. Or, I mean, I think that I never would have chosen the path that I've walked 10 years ago because I've changed as I've grown and through the experiences. So it's hard to say like, I'm going to do this for the next 30 years because I think 5 years from now, I'll have a different opinion.
Great. Thank you so much, Kayla. I know that we were not able to get through all of the questions, but if we have time at the end, we will be able to ask the panelists the questions. CCIH is also starting a Google group listserv for students and young professionals to create connections, share opportunities, and learn from each other. So we encourage you to send any remaining questions to the group by emailing CCIH. Carolyn will put the link into the chat. And I have noted all of the 3 questions that we had on that we have not been able to answer. And I'll be able to add that to the Google group so that the panelists and other people can chime in on your questions. So next, we want to ask you questions. You can either raise your hand and unmute, or you can put your response in the chat box. So the first question is, what has been the most valuable advice you've received as a young professional? I'll read the question again. What has been the most valuable advice you've received as a young professional? Prince said to explore and be open. Definitely agree. Jasmine feels the same. Mona wrote, talk to anyone and everyone. You never know who you are going to meet and what you can learn from them. I definitely agree with that. Never stop learning. That's a good one too. Great. The second question that I have, what would you like to see at future forums, webinars, and in our new Young Professional Google group posts? So what would you like to see at future forums and in our new Young Professional Google group posts? Networking opportunities and continued advice. would love breakout opportunities to meet and network with other young leaders, MPH students. Great. Yeah, please, I do encourage you to start having conversations in the Google group listserv, and being able to connect with other students and other professionals to get to create that network as needed. I think we have a few minutes for other questions that we can answer. So going back to the questions here. Doug, you had a question. I remember as a young professional feeling I wanted to change the world and being impatient with structures and organizations that seem to move slow compared to what I wanted to see. How do we cope without becoming frustrated? How can young professionals also effectively keep the heat on their managers? Dr. Huber, would you like to start?
I was afraid you'd ask me. I got great advice when I was applying to medical school and was successful from a clergy person who was kind of my mentor. And he said, you know, if you don't think you're going to save the world as a young doctor, you're not quite worth your salt. But if you don't get over it pretty soon, when you arrive on the scene, you're a damn fool. So I think we all have a sobering element of reality of how much can be done, but just staying with it and seeing how you work with teams. In medicine, sometimes we're in the quote solo performer category. Well, anymore the world works better with teams, and even in medicine, of course. But I think forming teams and working with your manager, supervisor, the leadership within your own organization is at least part of it. Not sure there's any, and it is frustrating. Sometimes we're not sure if we're a part of the solution or part of the problem. As internationals working in global health and cross-culturally, but keep learning and keep striving and asking for forgiveness when you need to.
That's great advice. And one more question. Regarding studying a master's in international public health, would you advise to first have experience in the field? If so, how long? Emmanuel or Kayla?
I'm happy to answer that.
Oh yeah, Kayla, go for it.
Okay, I'll keep it brief so you can talk too. I think that public health is one of those degrees that's a little bit more vague. So if you're studying engineering or nursing, it's kind of a clear path forward. So I think it's really important to go into an MPH program with a clear idea of what you want to do. And most often you get that through work experience. So I personally would recommend work experience if you have, especially if you have an undergraduate public health degree. But if you have an undergraduate degree that's like a little bit more clear of a skill set, then I think it's okay to go right into that. But I think in a public health program, it's not going to be laid out for you of like, this is what you're going to be able to do. So to know if you love statistics, or if you love grant writing, or if you love, I don't know, something else, it's really helpful to have a clear idea.
Thanks, Kayla. And in 1 minute, Emmanuel, would you like to add anything?
Well, I also think that some universities will inform you that maybe we need 2-year working experience or so. Like the school where I graduated, they clearly state that you have to have 2 years of working experience. So these are things that you can, but if the school hasn't stated and you can just enroll, I think you should go for it.
Great. Well, thank you everyone for your participation. And I just want to say a special thank you to all of the panelists that we have today. Please let us know what you think about the forum. There is a link on the chat where you can provide us with your feedback. Yeah, so thank you so much. And we hope that we will see you in future forums and webinars.
It's a pleasure to be with you, and I hope we will talk more.
Thank you so much.
Thank you, everyone.